Hello and welcome to Profiles and Issues, the Westchester Cable Television talk show that gives you in-depth interviews with business and civic leaders concerning services that can help your community. I'm your host, Dennis Rudin. Our topic for this broadcast is healthcare. How can people find healthcare services that they can afford? Our guests for the program are Gina Capelli, President and Founder, and Maria Trusa, Partner and CEO of Forme Medical Center in White Plains, Westchester County. Ladies, welcome to the show.
Thank you.
Thank you, Dennis, for having us here. We appreciate it.
My pleasure. One of the challenges that our country faces is, of course, health care and affordable health care. Not all employers have it for their employees, and it's not always affordable also. According to key statistics, there are 28.5 million uninsured people in the United States, and 16.1% of the uninsured population is Hispanic. So I'd like to start off first with Gina. You were a very successful business woman, I believe real estate. And what motivated you to get into the healthcare field?
So I worked 19 years with my family in real estate development, and I handled over 4 million square feet of office space. We had decided to sell our real estate to a real estate investment trust fund. And at that point, I had an option to stay with the company or to venture out on my own. So I decided to venture out on my own. I actually started Forme as a one-on-one personal training center. And it originated in Scarsdale. From there, I decided to apply for this very special license that we have, which is an Article 28 Diagnostic and Treatment Center license. This license allows individuals that are not doctors to employ medical professionals. So with that, I started physical therapy centers, and I had one in Scarsdale and one in Eastchester. I did that for about 14 years until such time as the shift in healthcare started changing. Doctors started opening their own centers, and I decided to take the license and expand it to really what it should be used for. And I opened a full medical center in White Plains in 2014.
Very impressive.
Thank you.
Very impressive. Okay, and Maria, how about you? What experience led you into the healthcare field?
So since I was a little girl, I wanted to be a physician. That was a dream of mine. But I came here when I was 15 years old and ended up getting married at the age of 17, having 2 kids by the age of 24. And things changed, but I became a medical assistant. And as a medical assistant, I ended up working at a Scarsdale Medical Group, a very prestigious medical center in the community here. And I ended up, to make a long story short, becoming the executive director. So I started as a medical assistant and became the executive director, and I was there for 26 years of my life. So I've been in healthcare over 32 years, I believe, 33 years. And in 2015, I decided to leave because, as you mentioned, there are 28.5 million people uninsured in the United States. And what I found is that working with the affluent community, and I saw people insured, but I was also having a lot of friends and family members that didn't have insurance and that were struggling. And to me, it was, I was sort of in turmoil, because here I know how to be part of the right healthcare system, but yet I cannot help these individuals that are family friends, that are families, that are my friends. So in 2015, I decided to leave my job, a job where I thought I was going to retire, and take on this journey to fix it. how to fix the broken healthcare system. And in 2015, my wonderful business partner and I got together. Gina actually reached out to me when she heard that I was leaving, and she asked me to join force with her. And I explained the mission that I had, that this was a vision. How do we help the community that is uninsured? And Gina was like, let's take it on. Let's do it together. She has the center. I have the medical background experience of running a business, in a very successful business that I took from 7 doctors to 50 doctors, from 35 employees to 250 employees, 10,000 square feet of medical space to 80,000 medical space.
I just have to ask you, curiosity-wise, and I know the medical industry has changed dramatically. I have personal friends. Some are physicians or in the allied health field, and when they started off, doctors could start their own practices, and now corporations run hospitals, etc. As an entrepreneur, did you run into any red tape trying to form your own company and feedback from the AMA?
Question. So an Article 28 is actually on the same lines as the hospital license. So when you apply for a license like this, or you want to expand a license like this goes out to the public board that hospitals are part of. So hospitals can actually protest you opening these sites because it actually deters business from them. So yeah, it took me 3 years to get this license, 3 years. And once it was established, it wasn't until 2 years after that I ventured out into my next facility.
So wow. It's an incredible story and incredible challenges, and you see how much the industry is changing, and also, without getting heavily into the politics, we still don't know from Washington yet how it's going to evolve with regard to general health care programs, and how it's going to affect your industry, and what they're going to allow you to do and what they're not, with funding and all of that. Okay, so tell us a little bit about how is Forme unique and different from other medical organizations, and by that, how can you survive, running a business when you're catering to people that are at the bottom end of the economic what do you call it, spectrum? Yes.
Well, they're not. So because what happens is, when you are someone that is poor, let's say you have no way of paying for your medical services, your medical insurance, if you're able to get Medicaid, right? But there is a population that is working that makes over the threshold of Medicaid, but not enough to be able to afford what they called Obamacare, but affordable care, because it is too expensive. So there is a lot of the working community. I'll give you an example of the millennials. The millennials are, many of them cannot get insurance because they cannot pay it. And they're now not on their parents' insurance because they're over the age. So there is a struggling community that is the millennial community. There's another struggling community that is working, but the employer is offering health insurance, but they cannot afford the premium that they have to pay, because most employers will cover you either 50, 60%. If it's a good company, they can cover you up to 70%, but still very expensive. So if you are a single mother and you cannot afford to pay the premium, even though you're being offered health insurance. There is also legal status. It depends on your legal status in the country. So 28.5 million people are uninsured, and those are the people that actually are working. Many of them are working, because if you're not working and you're poor, Medicaid and the government takes over you. So we're trying to cater and really resolve the broken system for this community.
All right. As a result of the Affordable Care Act and the current administration in Washington is not in favor of it, has tried to water it down, both financially and in other. But I just want to clarify this. Does a person have to still have to qualify physically? Do they have to take a physical, or can they now be available for your program?
So there's two things. There's two issues here. So for us, for the membership, we offer a medical membership, which is a very, very affordable. There's a 3-tier plan. It's very affordable for people to get the health care that they need. What we do at Forme is we push preventative medicine. Preventative medicine is very, very important. So for somebody to come in and be a member, we don't check legal status, we don't check financial status. We just have to be sure that you do not have other insurance. People that are underinsured can also have the membership, but we will not be billing your insurance company to cover any deductibles.
So what happens if they don't have any insurance? How do they pay?
So
How do
right
you
now,
know that you're going to get paid?
So to answer also your question, to add to it, we no longer have the pre-existing condition.
Right.
So you're able to get insurance, and you don't have to have a physical. You can just apply for insurance, and it doesn't matter if you had a pre-existing condition. Obamacare took care of that.
Okay.
But as far as, like Gina was saying, the 28.5 million people that don't have insurance, right now what is happening is a lot of people don't go to the doctor to have their physical because they don't want it, it's too expensive
Can't
to
afford
pay.
it.
But with the program, what we have done is really take a look at the healthcare system and see what is broken. So I'll give you a piece of information that most people say, wow, I didn't know that. You don't have, people that are uninsured, when you go to a medical practice, you're being charged 300 to 400% above Medicare rates. So if you have Medicare and you come to my practice and I take Medicare, I'll take $100 that Medicare is going to pay me. But if you are uninsured, you're paying $300 or $400 because you're uninsured. But yet, I take Medicare. And that's something that I never understood being in the system. How? Why? If these people are going to pay you, you just make sure that you get paid at the time of service. But every uninsured person is being overcharged in the hospitals, in the medical centers, in imaging centers, throughout the medical system.
We can give you an example. Somebody who is our member, and we've negotiated rates with a imaging company to do mammographies. She went to White Plains Hospital by mistake and got a $1,300 bill when we negotiated a rate at the imaging company for $100.
$100.
That's the increase. That
Why can't the average, when I go in and buy a suit, I can do, I know exactly what I'm paying.
Thank you.
Yet when people go for medical services, they have no idea until they get the bill what it is and what they're itemized, and they really go directly to their insurance. The people have nothing to say at all on any part of it.
I love that because that is the other piece that is broken in the system. There is no industry that you go and you actually don't know how much you're going to pay before you purchase the service, right? No industry. Somehow in healthcare, everybody thinks that it's okay that you go to a doctor, that you go to a hospital, and that you are going to not know what you're going to pay. You go home, you get a bill that is for thousands of dollars. I've been to the emergency room. It cost me $3,000 because I had an accident in a restaurant. Something hit me in the head, and I ended up leaving there with a $3,000 bill. I didn't know. I kept getting bills, and I'll give you an example. CAT scan, $1,200. I got a bill for $1,200. Do you know that if you are our member, you're going to pay $250? Because it's based on Medicare rates.
Is it just individual membership? Let's say a person has a small family business with 3 or 4 people. Would you take them as a group?
No, we take them as individuals. The company can pay the membership, but we take them as individuals because we're giving it away pretty much at the bottom that we could possibly do.
Yeah, that's what Gina and I were trying to figure out. How do we get this done? and not lose our business, because you have to make it profitable. Otherwise, nobody really wants to look at you. Investors won't look at you. The government won't look at you. You need to be profitable. So we figure out what is the bottom that we can, what is the lowest, so that we can provide healthcare services to the community. But in addition, like you discussed, transparency is key. In our office, we talk the financial language with you. You're going to have lab work. We give you the fee schedule, and we're going to tell you, this is how much your lab work should cost. Take these fees. When you get the bill, we want you to compare it, because that's what it should be. And if it's not, you come to us and we'll talk to Quest.
Okay, we'll have you mention this a few times in the interview, but before we get into actual services, if people want to reach out and contact you for more information, who do they email? What's the phone number?
They can call us at 914-723-4900. They can ask for anybody within the sales department, or they could really speak to anybody. We all are very, we know all about the
And
program.
the name of the company again?
Forme Medical Center. We're located at 7-11 South Broadway in White Plains, right next to the city center.
Can they look you up online also?
They can. We are www.formemedicalcenter.com.
Terrific. Okay, let's get into the services. What makes your company unique? What kind of, give me an example of the kind of services. Example, how many doctors do you have? Are they fully licensed? Are they physician assistants? What happens if I have a medical emergency? Am I going to wait for 10 hours, or do you still have to go to a regular hospital for that kind of thing? For that kind of problem?
So it depends, of course, it depends on your case. We try to be very clear with people and try to educate them on what is the difference between, let's say, a walk-in urgent care versus an emergency room. There are, if you have if you're having chest pain, if you have a open wound, gunshot type or knife, you go to the emergency room. You don't go to urgent care.
Okay.
But we take care of lacerations, asthma attacks, any type of headaches, UTIs.
Or fevers.
Fevers. We
Right.
take care of everything like that. So we're open. We're open 365 days. We give you access. Our patients really don't wait longer than an hour, and that's really only if we're very, very busy.
Is it 5 days, 6 days, 7 days a week? What are your hours?
So we're open Monday through Friday from 8 a.m. to 8 p.m.
And where are you located?
We're located at 7-11 South Broadway in White Plains.
Okay, and again, start with, I didn't mean to interrupt
It's
you.
okay.
So Monday through Friday?
Monday through Friday from 8 a.m. to 8 p.m. On Saturdays, we're open from 8 a.m. to 5 p.m. And on Sundays, we're open from 9 to 1.
Okay, so give us a rundown of the medical staff, the type of people, if a person comes in, or what type of different physicians serve on your staff.
So we have physical therapy, urgent care, primary care, gynecology, neurology, and podiatry. And our goal is to keep adding. There's other programs that we want to add to the system, but we need to grow a little bit more. We need more members, and this is something, Gina always jokes about the passion that I have, because I always say, if you are uninsured, and I really mean this, if you are uninsured, you need to be a Forme member. And this is our mission. This is what we wake up every day. We want to make a difference in your life, and we mean business. And we have, in the 3 years that we've been together, we have grown, but we need to continue to grow. And I tell people, our patients, I tell our members, continue spreading the word, because you see the benefits that you have. The more members that we can get, the more that we can offer. So if you are uninsured, $29.95 a month. Are you kidding me? Like, if you don't have insurance, just to get the discounts that we offer throughout Westchester with specialists, with Quest Diagnostic, we get up to 80% discount in labs, in medicine, in drugs, 70% discount from our local pharmacy.
Now, this happened to me, so that's why I'm asking. You mentioned labs. Do they bring this? Do they have to bring the sample to the lab, or is it
No.
Now, look, there was this company. I'm not going to name it. When I was starting out in a career in teaching, where they said, "Oh, we're less expensive, but you had to bring your urine samples or whatever to their lab. That's why they were less expensive."
Yeah.
So that's why I'm hitting you with all these.
We actually take the labs right there at our facility, and then the
All
lab
right,
company
just-
comes and picks up. And
All right, so let's say that I need medical. I wake up, I find out I'm sick. I call your office. How long is it going to take me to get an appointment to get in to see somebody?
if you wake up sick, you walk into the urgent care. You walk in that day.
That day, and
That day.
someone will be there.
Yes,
Absolutely.
that day.
If you are, there are certain selective appointments, like if you're going to schedule your physical exam, then you need to call and make an appointment. If you're going to schedule your GYN exam, if you're a woman, then you need to call and make an appointment. But when it comes to the urgent care, we're open every day, and you can just walk in. There's no appointments. I mean, you just walk in, and you're going to be seen. If you have a more serious emergency, then you get in sooner, right? So you get assessed when you come to the office.
Now, what I need you to clarify for me also is, do you have, what happens if a person, do you sell insurance also, or
No.
just the services?
We do not sell.
So in other words, if people go to you, they use your staff, right? Okay, fine.
But let's
You're-
clarify.
you're-
I was gonna say,
doctors.
So what we do is, we want you to be insured. So we want the person to be insured, because at the end of the day, you're gonna need insurance.
Sure.
You never know if an emergency happens, but we want you insured. So what we've done is we've teamed up with a few of the insurance companies, MVP, Affinity, and Fidelis. They work out of our office 5 days a week. So when we have an uninsured patient come in, the uninsured patient we put them through an eligibility type questionnaire. Do you know if you qualify for insurance? Have you ever spoken to anybody about getting insurance? And they're working at our office to be able to refer this patient to them to see if they even qualify for the low Obamacare.
And that relationship is great because they also get people that are not qualified.
Right.
So they're sending us those patients that are not qualified.
What happens if you, not just Hispanic people, because you speak Spanish,
Yes.
but let's say you get people in from other countries who don't speak English well. I mean, one of the problems that the government had with Obamacare, a lot of people were intimidated going on the internet, making the connection. Is it easier to make a connection with your outreach programs?
Well, like Gina was saying, we have the representative in our office, so you don't have to go online. You go to the representative, and for any of the insurance company, it could be Affinity, Fidelis, MVP, they're there and they will help you. They're the ones that are sort of going into the internet and guiding you through the whole process, and they tell you how much it's going to cost you. So that makes it easier, right? And that is a challenge for people that, we have a lot of Hispanic patients that come to us and they cannot read or write. So we are looking at all of the issues within our culture, like the Latino community, but within the uninsured community, and we are combining those issues and we're looking at solutions. Because I keep saying this over and over again. I think one of the things that frustrates me with the healthcare system here is that we talk about the same issues over and over again, but we don't look at solutions.
It's all the
I mean,
problem.
you don't hear many people saying, hey, let's look at this. And what I love about these, the two of us, I mean, think about it, these two ladies from Westchester, we are looking at solutions that are working, and we have it for 3 years and they're working.
Do you have any preventive measures at all? In other words, a lot of people, even wealthy people or middle income, they have terrible nutrition and diet habits, And that's what many times, gets them. That's what many times gets them, what do you call it, sick to begin with.
Mm-hmm.
Do you have any things like that where you speak to them and educate them?
So
Well, we do. Maria and I have Facebook Live shows as well.
twice a week.
Yeah, so we do one in English, Reflect and Reset with Maria and Gina. We talk about the topics, we talk about the important topics that are affecting people. And what people have to understand is that a lot of the times people don't go to the doctor until they're sick. And
Yeah.
and sometimes it's too late. And we are very, very pro preventative medicine. If you don't follow up with your doctor and make sure that your baseline is staying a baseline and things aren't happening, you can end up in the hospital very, very sick. And, so we are very, very pro, preventative medicine. And with our members, we were doing some statistics for the government, and we did 1,000 physicals on some 50% of the people never had a physical before. So, this is something new for them because a lot of the times they
Right.
don't go to the doctor until they need to.
So educating is key, and we are starting a campaign that's called Did You Know? And the idea is to bombard our patients plus the community in social media with information that they don't know. And we assumed that everybody knows that when you're 50, you're turning 50, you need to have a colonoscopy. I knew that because I've been in healthcare, and I know that's the way it is. So many people don't know that. English or Spanish speaking.
Right,
And
I agree.
the Did You Know campaigns, they're like 30-second videos just saying, did you know that at the age of 50, you're supposed to have a colonoscopy? So, and that you can prevent colon cancer by doing this. Did you know that if you are someone that in your mother or sister had breast cancer, that at the age of 40, you need to start having yearly mammograms? A lot of the people don't know. And all you hear is about the cost of medical, the healthcare system.
Yeah.
But let's put money into educating our community.
And on that note, we'll have to draw it to a close. Time is coming short, but I'd like to have you back. And what you spoke about educating people on colonoscopies and various checkups, maybe we can explore that program in the future also.
Love to do
Okay,
that.
mention again, ladies, please, the name of the company
So it's Forme Medical Center.
and where they can get
We're
in touch with you.
located at 7-11 South Broadway in White Plains. We are right behind the city center. Our number is 914-723-4900. You can look us up on the web at formemedicalcenter.com.
All of you are welcome. We always say, insured or not, we got you covered.
Yes.
That's great. I love that saying, okay? Thank you very much for
Thank
coming
you.
on the show. Gina Capelli, President and Founder, and Maria Trusa is CEO and Partner,
Yes.
correct?
Yes.
I got that right. Forme Medical and Urgent Care
Medical
Center.
Yes.
Okay, all of our programs can be seen free on demand at our website on www.thedennisrudenshow.com. And please, we want interaction. Email me at profile, PROFILE, .issue@yahoo.com about any comments about the show. Okay? Thank you very much. And this is Dennis Rudin saying so long for Profiles and Issues.